Welcome to today's live. Welcome to today's live. I'm just going to give a few minutes for people to join. And while waiting, you can see from the title of this video, it says Getting Pregnant in 2026. Getting Pregnant in 2026. The reality of these things is that if you've not worn a particular shoe, you don't know how it feels. You don't really know how it hurts, especially for those that are trying to conceive. You don't know how it hurts because you've not walked in that particular shoe. But when you walk on that particular shoe, you are able to know how people feel. You are able to know the pains of waiting every month. Like every month you keep waiting. Every month you always use the pregnancy test strip. Every month you keep checking, is it time yet? Every month you keep checking, am I pregnant? So it's a whole lot. It takes a lot of toll on an individual's mental health, emotional health, and all that. So today we're going to be talking about getting pregnant in 2026, what you need to know when it comes to getting pregnant in 2026. Um, if you are just joining, welcome to Nurses Lecture Room Live. My name is Mercy Mary. I am a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered nurse, where I work in the theater as an anesthetic and recovery practitioner. And I own a master's degree in public health because I am so interested in the public. And if you are just joining us, kindly let us know on the comment section where you are watching us from. Let us know your name and also where you are watching us from. And while the live section is ongoing, feel free to drop your questions, any question that is bothering you, anything that is actually disturbing you when it comes to reproductive health. Feel free to drop on the comment section as we discuss how to get pregnant in 2026. So we have Gabriel. Gabriel Noye, how are you doing? I know you've been frequent on our live, but I stopped the live for some time. I don't know. Yeah, I know Gabriel Noye. Welcome to Nurses Lecture Room Live. How is it going and how is it been so far? So we have Osmal. I think I don't really know how to pronounce that name. Thank you for joining our live. Can you let us know where you are watching from? We have King Baby J. King Baby J, thank you very much for joining our live. And I hope you are able to get value for our live section today. So I'm going to be starting with when it comes to fertility, everybody's journey is different. When it comes to getting pregnant, everybody's journey is different. It is nothing for you to be ashamed of. It is nothing for you to be embarrassed for of. It is like if this place is actually a non-judgment free zone. It's a non-judgment free zone. And we are going to be discussing about how we can get pregnant in 2026, how you can increase your chances of getting pregnant in 2026. And we will try as much as possible to address this topic respectfully. All right. So I'm going to be going in details. Okay, we have King Baby J say, I am from Alabama, United States. It's nice having you on our YouTube channel. Please let us know where you are watching us from as the live section progresses. There's something I want you to know is that getting pregnant is not just about stopping contraception and waiting. You know, a lot of people, they have been taking some family planning pills, they have been taking some contraception, and all of a sudden they stop, they want to get pregnant. So getting pregnant is not just about stopping that contraception and waiting. Planning ahead actually helps a lot. When you plan ahead, it helps to improve fertility. It also helps to reduce the complications associated with pregnancy, and it helps to support a healthy baby and a healthy parents. In 2026, lifestyle, stress, and health condition play a big role. So preparation matters a lot. So there are some people that they want to get pregnant, they have to stop their job. I've seen a banker who has been trying to conceive, but to increase her chances of getting pregnant, she had to stop her job for that particular time to focus on what matters to her at that particular time. I'm not trying to say you should put a hold in your career in quotes. I'm just telling you people from experience. She found out that her work was stressful to her, and what she had to do at that particular moment was to cut that work because at that moment, what she felt was a priority to her was to get a child. So in 2026, stress is going to increase. Our lifestyle choices is going to affect fertility. So that is why preparation is the key. That is why what preparation is the key. Stress is going to increase, our lifestyle is going to affect fertility. So, if cutting down stress is going to help you, it is very important to do that. Lifestyle modification, if you are a lady, you are a man, it's not just about the woman, it's about the man and the woman. If the man is into like taking a lot of alcohol, it's smoking, and both parties have been trying to conceive, it is very important to work on that lifestyle to see how you can reduce smoking or quit smoking, how you can reduce alcohol or quit alcohol, how you can stop the use of illegal drugs, or how you can stop the use of those drugs while trying to conceive. So in 2026, our lifestyle is going to matter when it comes to getting pregnant and when it comes to getting a baby. So Gabriel Noye said, I love this topic because I'm in this now, hoping on God to bless me with children. Hopefully, God is going to bless you with children and grant you your heart's desire. I don't know, yeah, you've been on our live several times about trying to conceive, and I would like to know if while the live session is going on, please let me know if you have been able to track down your cycle and if you've been able to like have sex during your fertile period, and if your husband has been able to do some semen analysis. I would like to know how far, because I know when we were doing some consistent live, we had some set of people that we had to help to calculate their cycle, and some were able to get success, not all of them in quotes, because I don't want to say all of them, at least a huge percentage of those that participated in our life were able to get pregnant with the help of tracking their cycle, husband doing semen analysis and working on their diets. They were able to see improvement when it comes to getting pregnant and fertility. Just let me know how far, what you've done so far from your end, and what is your anticipation. So let's continue with the topic. Let's continue. So the first thing I want to talk about is that how can a baby be, how is pregnancy formed generally? People just say, oh, when you have sex, you get pregnant. No, getting pregnant is more than just having sex. Getting pregnant is more than just having sex. So most people see that, oh, anytime you have sex, you can get pregnant. No. Like earlier said, getting pregnant is more than just having sex. What makes the pregnancy happens is that there has to be a healthy egg. There has to be a healthy egg. Like as a woman, you have to produce a healthy egg. And as a man, your sperm has to be healthy too. You get? So that is why when couples are trying to conceive, they don't just say, oh, the woman should go for fertility test. The man is also involved. So for pregnancy to take place, for a baby to be formed, there has to be a healthy egg and there has to be a healthy sperm. All right? There has to be a healthy egg, there has to be a healthy sperm, and also the fetus after fertilization. Now, when the egg and the sperm meet, the fetus has to implant in the uterus, which is also known as the womb. If any of this is not in place, pregnancy is not going to take place. Even if you have sex back to back, even if you have sex 30 days in a month, if there is no healthy egg, there's no healthy sperm, and the fetus is formed and is unable to implant in the uterus, pregnancy is not going to take place. And as a lady trying to conceive, I can never overemphasize the benefits of knowing your safe cycle, of knowing your safe days, of knowing the days you are fertile, of knowing the day your body releases egg. Because as a lady, when you release that egg, when that egg is released, it only spends 24 hours. That's like a day. After that egg release, if the egg doesn't see sperm, it is gone and it is gone. So your egg as a lady only stays in your body when it's released for 24 hours. And approximately as a lady, we can say that your body releases egg once a month, once in your cycle. So we can just say once in a month. Though some people like see their menses twice in a month. But generally, your body releases egg once in your cycle. And that egg only stays for 24 hours. After that 24 hours, the egg does not see sperm. That month is gone. You cannot get pregnant that month. So that is why when trying to conceive, it is very important to ask yourself this question. Do I have a regular cycle? Do I have a regular cycle? If I have a regular cycle, what is my fertile period? What is what? What is my fertile period? Which day am I releasing egg? Which day is my body going to release egg? So that's something a lot of people need to take into consideration. Sometimes we talk about, oh, I've been trying to conceive, but your husband is not always available. Probably your husband goes on a trip, like travels for some time, comes back, spend 1 week and go away. So that 1 week your husband is around, it might be that your husband, like you are not ovulating during that period. The period your husband is around, it might be your body is not ovulating during that period. So that's something you should take note of. So Chinecherem, how are you doing? Trust you are doing great. It's nice having you on our YouTube channel. So I'm just explaining. Thanks for joining. So it's also very important that when you are trying to conceive, the presence of your partner is very important in the house. Because like I earlier said, your egg only stays in your body for 24 hours. So if the period that you release that egg, your partner is not around, you cannot get pregnant. So if your husband is always traveling, try and see how you can calculate your cycle, that's your fertile period, and make sure that during that days he's going to be around, you are in your ovulation period, you're in your fertile window. So taking into cognizance your husband's availability, it's very important. And taking into cognizance your menstrual cycle is very important. That cannot be overemphasized. So that is why if as a lady, you've been trying to conceive, you've been trying to get pregnant, but you don't know your menstrual cycle, that is your first assignment. Start it today. Let's start it together. I want to go on this journey with you. I want to see what I can do from my own end to help you. So it's going to give me great joy. Like the joy of doing Nurses Lecture Room doesn't come from, oh, I'm teaching or from the views. It comes from the little people that have benefited and have been able to conceive from our videos. So that is where the fulfillment comes in. So I really want to take a lot of people on this journey. Like, start it. Let's track your cycle. All right? If your ovulation is starting today, put it down. Write it today. Next month, the first day you see your menses, put it on the calendar. These days, there are apps that help you know your fertile and your unfertile period. There are apps that let you know when you are ovulating, when your menses is coming. So you can also give that a try. So that is going to go a long way to that. So knowing your ovulation period, making sure your partner is available during that period is going to go a long way to help. So what I'm going to do, I'm going to finish the full topic, then I'm going to take questions. I think that's going to be better so that I don't end up having hinges on each side. So what I have here is that pay attention to your menstrual cycle. It is very important. Start folic acid as advised by a health professional. So you can start taking folic acid because if you are trying to conceive, the first 3 months of like the first few weeks, let's just say 3 months, you require like folic acid in a good amount, a good amount. If you are trying to conceive, folic acid is very important because it's going to help for your baby's spinal cord formation and the brain formation. So you can start taking folic acid as advised by a health professional. If you have PCOS, diabetes, or thyroid issues, PCOS, diabetes, or thyroid issues. So it is very important for you to manage these conditions. It is very important for you to check out your treatment options. So that's something you should take into consideration. Then also prioritize your mental health and stress management. You see, stress. See, most people that are trying to conceive, like they are stressed out. It tells on them emotionally and mentally, and it makes things worse. So what I advise, I know I am not in the shoe, so I don't really know how it hurts. If there's a way you can focus on the positive side, focus on the positive side, avoid the negative side of, oh, I've been married for so years, I've not been able to conceive. I know it's not easy. I know, like, I've been in a country where women are being criticized for not being able to give birth. But for your own good, it is advisable for you to focus on the positive side of the whole thing. All right? And try to look for solutions rather than focusing on what people will say, because people are going to talk, especially from where I'm from. All right? So that is that. So for for the women. So prioritize your mental health and stress management. Then for the men, healthy sperm improve your chances of getting pregnant, reduce smoking and alcohol, maintain a healthy weight. Healthy weight is very important. Healthy weight is very important. If you are trying to conceive and you notice that you are overweight, try to do some exercise, try to go on a weight loss journey. It's going to help, because like when you are overweight, it's kind of puts you at risk, a little bit at risk of infertility. So try to reduce your weight a little bit. So that might go a long way to help. And as a man, don't put the blame on your wife. It's your responsibility to support your wife emotionally and physically, because that's going to go a long way to help your wife, to help your partner. All right. So we're not going to be talking about the lifestyle changes. So small changes can actually make a huge difference. Remember, I said that lifestyle affects, and that first one I talked about was managing your stress. Another one that can help is eating balanced meals. Eating balanced meals. It's not just about eating, because these days there's an increased incidence of PCOS, that's polycystic ovary syndrome. There's increased rate of infertility these days. So eating balanced meal, eating fresh, healthy food. I kind of emphasize the benefits of eating fresh, healthy food. It's very important. Rather than eating those processed canned food, it's better for you to just prepare your food and eat. Rather than those processed food, rather than those canned food, rather than those spicy, those chips, those things you get over the counters. It's, if you can, it's advisable for you to make your own food yourself. If you can see the word, if you can, like, it's better for you to eat fresh meal. Even if you're not making it yourself, if you can get somebody to be making fresh meal for you, that's perfect. Exercise regularly, but don't overdo it. Listen, exercise is good, but don't overdo it. Everything you are doing should be done in moderation. Then sleep. Sometimes we underestimate the power of sleep. See, I know, like, I don't know how, I've had family members that have been trying to conceive, and most times she cries all through the night. She cries all through the night because she went out. She had it started with people. Oh, like, I don't really know how to put it. Like, I feel for those that are trying to conceive. It's a lot on them. All right. Especially, there are some countries that people don't really care, but there are some countries they make it as if you are doing something wrong. You go outside and they say, oh, look at that woman, that barren woman. They start tagging you by that name. They start tagging you by that name. And as somebody that personally wants to have children, when you go out for birthdays, when you go out for celebrations and you see kids, even if you are trying to be strong, it takes an emotional toll on you. Then you go home, you start crying. You start having sleepless nights. So that crying and sleepless nights, I know you are trying to let out your emotions. It's not going to help out. It might make things worse for you. All right. So that is why it's advisable for you to focus on the positive side. If you can, do things that make you happy. Stay away from negative energy. Anything that you know is going to bring that energy, that your vibes down, to make you weep, to make you ponder, stay away from it. Try to look for things that, like, put yourself as a priority. Put yourself as the center of, like, put yourself as the star of the show. I don't know how to put it now. Make sure you are a priority. Make sure your health is a priority. Make sure your happiness is a priority. Why trying to conceive? Why trying to get pregnant? Because if you start thinking too much about what people say, it's going to make things worse rather than help you in the long run. All right. So I know it's not easy. I'm talking from what I've experienced and what I've seen. Because a cousin of mine, a particular cousin of mine, just put to bed. She got married for years and she could not conceive. It was a lot on her. She would call and cry. She would call. It was a lot. She was like, oh, I don't know what's wrong with me. Is it my past? She kept blaming it on her past. She kept blaming. It was a lot on her. So that is why when we come out to talk about this, is a video to support you It was a lot. So what I'm trying to say is that don't let that get into you. Let the positive side of life, let the blessings that you have around you be the reason for your happiness. Then you're going to see improvement. So I talked her through about being happy. I talked her through about different options because we found out that she had PCOS and we started treatment. She has to go see the doctor and she got expert care. She started taking her prenatal vitamins, and lo and behold, she has put to bed recently. So what I'm trying to say in summary is that focus your energy on the positive side. Do all the fun thing that you know while waiting. Tell yourself, I have to enjoy myself before my baby comes. So let me do all the enjoyment before the sleepless night come. I think you should focus your energy on that while trying to stay positive and work towards having a child rather than focusing all your energy on negativity like, oh, I don't have a baby. What could be the cause? This is saying this is saying that. I understand. But just try and put yourself first. Try and be selfish and say, me first. Try and be selfish and say, I need to talk about me. This stress is not making me happy. Try and be selfish. Just think about you. Think about your happiness. Think about what you want to do. Focus on something else that keeps you happy, that keeps you excited. Don't spend the whole day pondering about what people say. All right. So that's that. Get quality sleep. The crown of what I'm saying is that get quality sleep, manage stress, and limit exposure to chemicals and excessive heat. So limit exposure to chemicals and excessive heat. So that's that. So we have extra. Thank you very much. Though I don't understand your language. And if you know you've been following and you are getting value for what is being said, kindly drop on the comment section. That's going to tell me you are following. Just say, yes, I'm following. Just do thumbs up. Just drop something in the comment section. That encourages me to go further because now we're going to talk about the myths and common mistakes. So I'm going to go into the myths and common mistakes. Then we're going to talk about when to seek medical advice, and the floor is going to be open for questions, and we're going to be taking questions. So now we're going to be talking about myths and common mistakes. So if you know you've been getting value, just drop on the comment section. Don't be shy. Drop on the comment section. Okay, if you know you're getting value from our live session, just drop. Let me know you're following at least. Let me know I'm not talking to the cloud. I'm talking to people that really wants to get the information. All right. Okay, thank you, Noye. So I'm going to move forward now. The next is myths and common mistakes. There are some myths and common mistakes that we think about. So the first myth, let's clear up some myths first, and that is pregnancy does not always happen immediately. Pregnancy does not always happen immediately. In terms of pregnancy happens, like I earlier said in the beginning, when there's an egg and there's a sperm, pregnancy happens. All right. It's not like every time you have sex, you're going to get pregnant. Back then when I was growing up, when I see a young lady getting pregnant, the only thing that comes to my mind is, oh, she had sex and she gets pregnant. I just feel she had sex just once because I feel anytime you have sex, you're going to get pregnant. So the best thing, don't have sex at all. I think that was one of the education my mother gave me. It was like, if you have sex with a guy, you're going to get pregnant. So don't have sex at all. So pregnancy does not always happen immediately. It happens when there is an egg and a sperm, and you're on your safe period and everything goes that way. So age affects fertility, but it does not mean pregnancy is impossible. Yes, generally as a woman ages, her fertility rate decreases. But that does not mean when you age, you cannot get pregnant. That does not mean you cannot get pregnant in your 40s. You can get pregnant, just that as you increase in age, the chances reduces. But there is a possibility you can still conceive at that age, as far you are seeing your menses and you are ovulating. So age does affect fertility, but that doesn't mean that you cannot get pregnant. And somebody said herbal remedies are not always safe or effective. Then fertility apps are helpful, but they are not perfect. Fertility apps are helpful. So what I would advise you, they are helpful, but they are not perfect. You get? You can put in your ovulation, your menses. Sometimes fertility apps tells you that your menses is going to come today, but it's going to come like 2 days. It comes 2 days afterwards. They are very helpful, but they are not perfect. So that's something you should take note of. So you may want to ask, if you've been trying to conceive, when should you see a doctor? If you have been trying to conceive, you just got married, you've been trying to conceive. If you've been trying for the past 12 months, that's a year. If you've been trying for a year and you are less than 35 years of age, you are not above 35 years of age, you can try for 12 months. If you've tried for 12 months and nothing is coming up, then we can say there's a problem of infertility and you need to see the doctor. But if you are above 35 years of age, you need to start seeing the doctor after trying for 6 months. After 6 months, you are trying, you go and see the doctor if you are above 35 years of age. Then, if you have irregular cycles, you are trying to conceive, is not working, see the doctor. Like your period is not regular. This today, the first cycle is like 30 days. The next one, you're seeing it after 40 days. So if you're having irregular cycle, you're having heavy bleeding, that might be something of concern for you to see the doctor so that they can help as soon as possible. Then if you have any previous reproductive health issues, for example, you have your fallopian tube taken out, any previous surgery that was done in your reproductive system as a man, as a woman or a man too, you had fibroid, anything at all, anything in regards to your reproductive health, you've had it previous in the past, you've had abortions in the past, you've had fibroid taken out in the past, you have your fallopian tube taken out in the past, you have PCOS in the past. If you have all these past medical reproductive health issues, it's very important for you to step up and see your doctor for useful guidance. Then pre-pregnancy backup checkup. So I think that's all I have to share. That's all I prepared for you today. Yeah, so that's all I have in stock for you today, and I hope you got value for it. So now is the question and answer section. If you have any question, let me know in the comment section. So we have Noye. Noye dropped a question. Said my cycle is 35 days, but since September, that's September, October, November, 3 months ago. Since September, it's coming late after 2 or 3. Another thing is that I don't see mucus discharge. Can I get pregnant without it? Some people during ovulation, they might not notice that mucus discharge. Some people during ovulation might not notice that mucus discharge. Yes, that doesn't mean they are not ovulating. That doesn't mean they can't get pregnant. So that's something you should take note of. And you having delayed period during that period, little things can delay your period. For example, stress, like I earlier explained, that stress affects fertility. So stress can delay your period. It can make your period come earlier. It can actually make your period come late. So stress affects your period. Then also sickness. If you've been ill during this period, for example, you had malaria, you had typhoid, you had some illnesses that you had to treat, that can affect your menses. Personally, when I was in Nigeria, when I treat malaria, I'm on malaria drugs or I'm on typhoid drugs, I fall sick, I have to go to the hospital, my menses is usually delayed. It delayed a lot. Personally, that's my personal experience. But yes, if you are on treatment, on any medications, that can have some significant effect on your period and can cause delay in your period. Okay, so that might be the reason why you're having delay. Maybe during this period, you've been stressed, like for the past 3 months, you've been stressed, you're having delayed period and all those bits. So that can affect your period. So what I would advise you to do, Noye, you can actually go for fertility. I don't know how long you've been trying. I know you've been following this channel for some time now, but I can't remember how long you've been trying. But I don't know if your husband has gone for semen analysis. And remember in my previous live sections, I talk about food that you can take that can help boost your fertility. Where we talk about the men having bananas, spinach, fruits, veggies. Like, I think I'm going to make a live section listing the different types of food that you can take to boost fertility. So that's going to be our live session tomorrow. We're going to be working on the food that boost fertility and why this food boosts fertility. So if you want to follow up on that live, kindly join our live session tomorrow. I'm going to research more on foods that you can take. Hopefully you can incorporate that in your diet, and that is going to go a long way to help to boost your fertility in the long run. But one thing I know is that yam is very good. Yam is very rich. Eat a lot of yam, be it fried, cooked yam. It's very rich. It's good for fertility because some research shows that it has a phytoestrogen in it that helps. And okra is also good. Okra is rich. So you can have a lot of okras. You can see people say, like, there have been a lot of people coming out to say when they take okra water, it helps to increase wetness in the vagina. So that's because okra has this estrogen-like stuff in it, which I'm going to be explaining tomorrow. I'm going to be listing out different foods and explaining the impact in fertility and why you should incorporate that food into your diet tomorrow. So diet goes a long way to help. Like in places like it is the Yorubas. If you notice, the Yoruba has high number of twins. The Yorubas in Nigeria, they have the largest number of twins in the world. And that community is known as Igbora. I've made a video on that. The community is known as Igbora. And when they decided to dive deep into this Igbora community, they found out that the food they eat the more is usually yam and okra. They found out that the food these people eat in the more, they are usually yam and okra. So that actually could possibly increase their chances of them getting multiple pregnancies and twin babies. So what I'm advising you for the now, you can add yam and okra, and tomorrow I'm going to be adding more options when it comes to diet that can help improve your fertility. So I don't know if that helps you, Noye. If that also helps you, Noye, just let me know in the comment section. And for those that have been trying to conceive, if it's like more than a year, make sure you see a medical doctor, make sure you see a fertility expert, so they can do fertility tests on both the man and the woman. I think for the woman, they have to do some semen analysis. Sometimes a man can have the amount of semen they require, but the sperm are not moving, like they're not, the movement, the morphology is that the morphology is not there, like the formation is not in the right shape and all those bits. So you can actually do some semen analysis. It's not like semen analysis is not just about sperm count. They're not just counting the sperm. They're checking the health of the sperm. They're checking if the sperm is capable of fertilizing an egg. So that is part of semen analysis that is being carried out. So that's so why it is very important for couples that are trying to conceive to actually do the semen analysis too. So tomorrow I'm going to be coming live again, and we're going to be analyzing the different types of food that actually helps to boost fertility. So if you know you want us to talk on that tomorrow, kindly drop on the comment section. And if you've been getting value so far, kindly drop on the comment section. If you are just coming across this channel, my name is Mercy Mary. I am a registered nurse midwife, but I'm currently practicing in the UK. And my interest is actually public health. So because of my interest in public health, I did a master's degree in public health. Yes, because I really want to help people outside. It's a whole lot, like a lot. People need to get a whole. So I have another question. So we have Ibrahim said, is it normal to have a free day without blood flow in an 8-day cycle? Like have a flow for 4 days, stop completely for 2-3 days. It is not normal. Ibrahim, it is not normal. Normally your flow is supposed to go through then stop. That's one thing I know. So if you are having that, it flows for 4 days. It stops for 2 to 3 days. When you say it stopped for 2 to 3 days, when it comes back, is it like a heavy bleeding, or it's just like a tiny bit of discharges? I want to know. Is it like heavy bleeding, or like it comes, it's a tiny bit? Let me know in the comment section before I give you advice, please. Let me know. If it stopped for after 4 days, it stops for 2 to 3 days. It's light. If it is light, if it's very light, it's like spotting, it might not be something of concern. It might just be your womb shedding the remnants out. It's just be like the secretions are helping you to wash the remnants out. It's not going to be like something of concern. Okay. If it's light bleeding and it just happened for like you saw a little bit, then it's not something of concern from my own point of view. So he said, like, I need to see my period last. So Ibrahim, let me know if your question is answered. If it's light bleeding, it is nothing to be concerned about. Okay? But if it's like heavy, then it's something for you to see the doctor about. If it's just something light after some days, it's okay. It's not something that's dangerous. But if you are concerned generally, you can see the doctor. So we have Omolara. Omolara said, I need to see my period. Doesn't mean I need to see my period last month on the 28th. but it's only a little blood I've seen. But on the first of this month, I see it for 5 days. 28, 29, 30, first. You saw it on the 28th, 29, 30. Then you saw it on the first of this month. I need to say, if it's little, for me, if it's little, it's nothing of concern. But if it's bleeding, like severe bleeding, then it's something you should see the doctor about. And I would like to know, is it constant? Do you see it like, does it happen regularly, or is just once in a blue moon thing? Sometimes it could be hormonal fluctuations. It could be like your hormones are fluctuating. All right. Ibrahim, let me know if your question is answered. And Omolara, let me know if your question is answered. Omolara, is your question answered? I think what happened to Omolara and Ibrahim, they are similar. You get, they are pretty similar, because you can see it's just sometimes it's hormonal fluctuation, is stress, illness, you traveled to it, all those things can affect it. So if it's little bleeding you saw, and afterwards you saw your normal period, then to me it's not dangerous. But if it's like heavy bleeding, you saw heavy bleeding for days and later you saw another one again, then it's something you should see the doctor as soon as possible. But if it's just like spotting, light bleeding, then it's not dangerous. Omolara, let me know if your question is answered. And Ibrahim, let me know if your question is answered. He said, that little blood, I sure it's... Are you saying the little blood lasts for 3 days? Are you saying that the little blood lasts for 3 days? Is that what you're trying to say? It's not enough. As far as little, it's not like heavy, then it's not dangerous. As far as little, are you on any family planning medications? Are you on any family planning medication? Let me know, Omolara, are you on any family planning medication? So Noye said, I do have 4 days cycle, but now it's 2 days and a drop on 3 days, So it's not, when you say cycle, I think you are getting it wrong. When you say cycle is like that long day that you're calculating. For example, 28 days cycle. That's what, when you say I have 28 days cycle, nobody can have 4 days cycle. You can say the duration of your period is 4 days, not the cycle. I think that's something you need to we need to clear. When you say my cycle is 28 days, that means from the first period to the next period. That's what the cycle entails when it comes to a woman. But you see, 4 days is like the duration of your period. It's not a cycle. It's the duration of your period. So you said, I do have 4 days cycle, but now it's 2 days, and a drop on a 3 day is a normal. It's okay to have the normal and drop for your menstrual cycle is between 2 to 7 days. 2 to 7 days. So if it's less than 2 days, then you should see the doctor about. But if you notice a drastic drop, for example, it was 5 days, all of a sudden you start seeing it 2 days, or it was 4 days, all of a sudden you start seeing it 2 days, and that might be something of concern that you need to speak with your doctor about. All right. So Omolara said yes. Okay, Omolara, what should I say? That you said yes, you said no. Okay, Ibrahim said, okay, thank you. Question answered. You're welcome, Ibrahim. Omolara, sorry. What did I ask you again? I say it's in for 5 days. I can't remember my question. Why am I having brain lag? What did I ask Omolara? Omolara, you gave me to answer yes and a no. So I don't know which one is the right answer to your question. You said yes, and you also said no. Just type and let me know what stand you are, if it's a yes or if it's a no. Hope you are following the live. Hope you are enjoying the live section. Thank you very much for joining the live. And I'm super excited that I got a lot of questions on this live section. So if you are watching and you've not double tapped to like the screen, kindly double tap to like, and it automatically likes the screen. It automatically likes the video. All you have to do is to double tap to. Okay. Yeah. So family planning medications can actually cause some hormonal fluctuations, can actually alter your hormones a little bit. So that could be the reason why you're having it. Okay. That can alter it a little bit. So if you're on family planning drugs, so it can be birth control related spotting. But one thing I advise is that if you notice it's heavy, it's very important for you to see your doctor. If you notice the bleeding is consistent, then see the doctor about it to actually get proper guidance. And if you've been watching so far, all you have to do is to double tap the screen and it automatically likes the video. You double tap and it automatically likes the video. Okay, Omalara, you're welcome. Time is nice having you. And if you're joining us, Omalara and Co, and you've not subscribed to our YouTube channel, all you have to do is to click on the subscribe button and turn on the notification bell. Tomorrow we are going to be discussing an interesting topic, and that is the drugs, the medications that you can take to be able to help you increase your chances of fertility and why you should take those medications. So that's what we're going to be discussing tomorrow on our live section. So to get updated, all you need to do is to subscribe and also turn on the notification bell. So Noye says, sorry, mistake. I mean my period last 4 days, but changed to 2 days normal flow and a drop on 3 day. I don't understand that. I'm still trying to understand what you're trying to say, Noye. You said, I mean my period last 4 days. My period last 4 days, but changed to 2 days normal flow. Okay, on the 3rd day, you see a drop. It's okay. So 2 days is okay. 3 days is okay. It's okay. How long have you been trying, Noye? How long have you been trying? Is your husband available? Have you done some semen analysis? Do you want to talk about it? Noye, let me know how long you've been trying. Don't forget to double tap the screen as it automatically likes the video. Please and please, if you are watching, double tap the screen to automatically like the video. We're done with today's topic. Now is the question and answer section. If you have any question, feel free to drop on the comment section. I am willing and ready to take those questions. Then what I discover again is my breast is painful. Okay, when you talk about your breast, does that painful breast occurs at a particular time of the month, or is like a painful breast all through? You're having a painful breast every day, or you notice that during your menses you're having painful breast, or during a particular time of the month you usually have a sore breast. So, or how is the breast pain like? Is it like every day or a particular time that you notice that breast pain? So that's going to tell me what to tell you. So is it everyday breast pain, or when you are on your period, close to your period, when do you usually feel that pain? Or there's a particular time of the month you feel that pain? Let me know in the comment section, Omalara. Okay, if it's close to your period, then it's normal. It's like premenstrual symptoms. Women experience that premenstrual symptoms. But if the breast pain is something that is always there, then it's something you should see the doctor. So some women experience some amount of breast pain during their period. Some experience it close to their period. Some experience it during ovulation. So it's different for people. But if it's like everyday pain, like the pain is constant, then see the doctor. But if it's happening at a particular time of the month, then to me, it's a normal thing. But if consigned, see the doctor. But generally, those pains are usually like, Amalara, are you following us on our YouTube channel? Does it stop after your period? Does the pain stop after your period? Does the pain usually stop after your period? If it stops after your period, no concern. To me, no concern if it stops after your period. If it stops after your period, to me, there is no concern. Where did you drop your message, Omolara? No, yeah, sorry. No, yeah, where did you drop your message? I can't see your message. Okay. Have set me this year. But since then, I've been trying and we have carried out some tests and everything is fine, but my hormones profile is not out yet. You said I have bet set me. I don't, doesn't mean, okay, no, yeah, I've seen it. I saw something like, you said I have bet sets made this year. I don't understand what that means. If you can explain further. You said I had bet sets made this year. And you also said your hormonal profile is not out yet. Sometimes when your hormonal profile is out, they're able to know if there's a hormonal imbalance, and the doctors might give you some medications or supplements to help out. So I don't know what you said. I have bet sets made this year. I don't understand what that means. Hello, Judith. How are you doing? Oh, all right. Okay, okay. May, June, July, August, September, October, November, December. All right. So just give yourself some time, okay? I believe you should be fine. I'm sorry for the loss of your baby. I'm really sorry about that, Noye. So you wait for your hormonal profile results and keep trying. As far you can conceive the first one, definitely you can also conceive another. All right. So I don't need you to worry. Like I earlier said at the beginning of this video, I don't need you to worry. I don't need you to panic. I need you to focus all the energy on something positive. So don't feel bitter. I know it's not easy because as of now, I am not the one wearing the shoe. So don't feel bitter. Don't feel sorry for yourself. Put yourself at the center of it all. Put yourself as a priority. Put yourself like in charge. Make sure you are, I don't know how to use the word. I'm trying to look for the right word to use. Just make sure you take care of yourself. Just make sure your self-care is a priority. Your mental health, everything is a priority to you. You are a priority. That's my advice. Okay? Don't feel bad. I know it's not easy. So don't feel bad. Don't feel sorry for yourself. You can actually try again and actually conceive. All right? Do we have any question coming? We're done with the topic for today. We need more questions coming as we anticipate tomorrow's topic. Do we have more questions coming? So if you are watching and you've not double tapped the screen to like the video, kindly double tap on the screen to like the video. The live session is likely going to end in the next 8 minutes. So feel free to ask your questions. Amolara, I thought I answered your question, Amolara. I talked about the breast pain. The last question I got from you was the breast pain. Is it that question? The last question I got from you, Amolara, was the breast pain, and I actually responded to it. Is that a question you're asking again, Lara? Yeah, I said that if the breast pain usually occur at a particular time of the month, it comes, and after your period, it goes, then it's not something of concern. All right. But if the pain is consistent, then it is something of concern. So that was what I said in regards to that pain. Did you get the answer? Lara, did you get the answer now? Did you get the answer now, Lara? Okay, that's fine. Do we have any more questions? We have like 6 minutes more to end the live section. Do we have more questions? We're done with the live sections. For those that missed the live section, feel free to rewatch the video. It's like it entails a lot. For those that missed the live section, feel free to watch the video. And if you have any question, also feel free to drop on the comment section. All right. Oh, somebody just Undubisi just joined, but I have a very important question. Okay, Undubisi, I'm gonna give you some time. So ask your questions now. The live section is supposed to end in 5 minutes, but I'm generous. So I'm going to be generous in the BC. So feel free to ask your questions on the comment section. Quickly. And if you're watching, you've not given us a thumbs up, just double tap the screen. Just double tap the screen. CQ10. This is the first time I'm hearing about CQ10, but the one I know is like COQ10. All those ones are very good for, they are very good for sperm health. They are very good for your egg health. So if you are taking it, it's not a method of contraception. It's helping to boost your sperm health to increase your chances of getting pregnant. Is that what you're trying to say? Are you trying to say if it helps to help a woman get pregnant? Is that what you're trying to say? If it helps to get a woman pregnant? Okay, yes, it does. It does. It's a COQ10. COQ10, you wanted to write coenzyme, whatever. It does help. But I don't really know how to go about that. But I know it does have it has benefits when it comes to sperm health, when it comes to egg health. So it does have a lot of benefits. So I can say it does. I don't know if I think they sell it as supplements these days, but it can be found in some food we eat. It can be found in the food we eat, for example, like fatty fish, organ meat, whole grains, nuts, and seeds. So it can be found in some food we eat, and I believe they sell it as supplement these days. Does that make sense, Student BC? Student BC, does that make sense? You're welcome. But generally, what I advise, always speak with your doctor, okay? But I know it has like this CoQ enzymes. It has like, it's a natural substance that's found in our food, like I earlier said. It has a lot of benefits. It's not just fertility in general. It helps with a heart health. It helps with energy and fatigue, migraine, and your general wellness. So I know it is, but generally, when it comes to fertility issues, I always advise you consult your doctor. This is not me. This is not me telling you to go and get the CoQ10 supplements and all those bits. Always consult your doctor, but it has fertility benefits. It has fertility benefits. So do we have any more questions? We've taken Undubisi's quick question. He came at the right time. The life was about ending. Then he or she came at the right time and we were able to answer he or she's question. I don't know if it's a male or a female, but it's fine. So this is me saying thank you everyone for joining our live section. It's nice having you in our live section. Feel free to subscribe to our YouTube channel, click on the notification bell just in case you have any question, ask on the comment section of our video. You can check out our recent videos where we're talking about abortion. I think this abortion thing is not for people, it's not related to what I'm discussing today, but that's the video on our YouTube channel. And probably we're going to be dropping a video today on that too, like a series. We're doing a series on abortion. So we're going to be dropping another video about it today. Then what do I have to say? Subscribe, turn on the notification bell, because when you turn on the notification bell, it's actually okay. Yeah, she all right. Okay, it's nice. When you turn on the notification bell, it actually lets you know when we are online, because like I said, I can't really tell you when I'm going to be live, but I'm going to try my best to always show up for everybody, and I'm going to be showing up for everybody. Then turn on the notification bell so you get informed. And what do I have to say? Yeah, that's all I have to say. And if you've not double tapped to like the video, just double tap on the screen, want to, and it automatically likes the video. I will encourage you to do so. Then what do I have to say? Tomorrow we're going to be having a live section, and on tomorrow live section we're going to be talking about the food that you can take that can help improve your fertility. The food that you can take that can help improve your fertility. So that's what we're going to be working on tomorrow. So don't forget to join our live section, especially those that are trying to conceive. Don't forget to join the live section. And if you've missed the beginning of this video, I will advise you to stay back and also watch the full video and get information. So that's from me to you today. And I hope to see you all in our next live section. I just want to hear congratulations. That's it. I really want to follow you on this journey. I just want to hear congratulations, I'm pregnant. Congratulations, I just put to bed. We've been getting a lot of positive response in regards to the teaching and how it has helped to improve their fertility. And we've got, I think it's high time for me to start sharing testimonies. It's very important. It's part of the thing. I think that's something I need to focus my energy on now. Start sharing testimonies of people getting pregnant and getting a baby. Most people will not want to share that they're pregnant, so they will want to share the news when the baby arrives. So I think I should focus my energy now on sharing all. If you know you've put to bed, just let me know so that I can share the good news. I hope to celebrate you, and I hope to celebrate your 9 months journey. All right, so I hope to do that. Thank you very much for joining our live, and see you in our next live section. Bye everyone. Thank you. Bravo, bravo, bravo. Thank you, thank you, thank you, thank you, thank you.